Diabetes Fiji is calling for immediate and comprehensive action to prevent further tragedies and improve the quality of life for people diagnosed with diabetes. Acting Chief Executive Marawa Kini says they recently lost 3 young members of their Young Diabetes Fiji program due to complications. RNZ's Delphine Herbert spoke to Marawa Kini about the tragedies.
It is with a profound sadness that we at the Diabetes Fiji Incorporate reported the recent loss of 3 young members due to complications related to diabetes. These tragic events underscore the urgent need for comprehensive actions to address the growing of diabetes crisis in our community. So, with the 3 recent cases, young people young people living with diabetes. They face a lot of, challenges in terms of, how they access to the health services. One of them is staying far from the subdivisional hospitals, who lives in interior of Narvosa. So, in terms of geographical layouts, that's one of the challenges. A type 1 who has to reach out to the services that is needed for her, which only available in the subdivisional hospital, which is in the west. The second one that was based on the how for them to take control their diabetes, and she's find challenging in terms of support. Both of them, they having a family challenges of the family support, where parents have they have raised from a broken family, and as explanation of the recent losses, the losses of these young lives is a stark reminder of the severe complication that diabetes can impose. Each of these individuals face a complication that were excreted and inadequate access to timely medical care and insufficient management of their condition. Despite our best efforts to support them, the lack of resources and awareness significantly hindered their ability to manage their diabetes effectively. So Diabetes Fiji is called for comprehensive actions. We are calling for multi-phase approach to tackle diabetes effectively. This includes increased funding, allocation more financial resources to diabetes care, research where Fiji is currently lacking with. That's something that we talk to the government of the day if it's something that we can rectify and work together and to support the program. Another highlight in terms of call for actions is education and awareness, implementing widespread education campaigns to raise awareness about diabetes prevention and management. Thirdly, I can say it's improve healthcare services and to enhance access of quality healthcare services, including regular screening, timely medical intervention, and availability of essential medications. So when talking about the increased funding, there's a need more funding in terms of education and services. Absolutely, more funding will enable us to expand our outreach and support program, as we are the only dedicated organization in Fiji to advocate more on this the issues of diabetes, which providing necessary resources for those affected by diabetes. Education is crucial in empowering individuals to take proactive steps in managing their health, and enhancing healthcare services will ensure that individuals receive timely and appropriate care, reducing the risk of a complication. Consequences of inactions. If we do not take immediate and comprehensive actions, the diabetes crisis will continue to escalate. This could result in the increase of morbidity and mortality rates, say placing a significant burdens on our healthcare system and impact the overall well-being of our community. We cannot afford the complaints, and the cost of inaction is far too high. As government already announced the budget for the financial year 2024 to 2025, that it costs 540 million to the health sector. So just 450 million that mainly were just a small portion that directly comes to us. And we're talking about these burden issues. but just a small portions have been dedicated, but mainly for the Ministry of Health. But the dedicated organizations such as us, it's not justified to us for their support. Additional remarks on this to the questions you've sent to me, that Diabetes Fiji Incorporated will remain committed to our missions of supporting for those affected by diabetes and advocating for better healthcare policies. We urge all our stakeholders, including government agencies, healthcare providers, and the community at large to join us with the crucial fighting against diabetes. Together we can make a difference and prevent further tragedies.